There are new recommendations about how often women should get screened for cervical cancer. The guidelines actually cut back the number of tests. Well-being reporter Alyssa Ivinson has more and reaction from a local doctor.
Well, the new guidelines suggest cutting pap smears back from every year to every 3. But a Fort Wayne OBGYN says that should not mean cutting back trips to the doctor's office. For many women, a pap smear is part of their yearly routine. But now, leading experts from the American Cancer Society and the U.S. Preventative Services Task Force say for most women, those annual tests aren't necessary. Instead, the cervical cancer screening can be done every 3 years.
The more often you do a test, there's a higher chance that you will come up with what we call a false positive. And false positive tests can be harmful because they may lead a woman down a pathway for further diagnostic procedures.
We can get carried away in treating something that's never going to hurt anybody. So being patient and understanding the disease is a real big part of it.
Dr. Todd Rumsey with Women's Health Advantage in Fort Wayne says patients and doctors shouldn't get caught up in guidelines. Instead, focus on an individual person's test results and risk factors.
It's a matter of meeting and speaking with your physician in a way that you can identify what's really necessary for me.
Dr. Rumsey says doing PAPs every 3 years for older women isn't uncommon, but the big change here is recommending the same timeline for women in their 20s.
We have to be cautious in labeling someone and their risk factors based on age alone.
So while it may be appropriate for some women to skip the yearly PAP, they still need to see their doctor every year.
There are lots of layers that are involved in an annual exam at the doctor's, one of which is the pap smear.
The groups that drafted the proposed guidelines will meet again next month to finalize them. They will then be adapted into a final guideline from the American Cancer Society around mid-2012. For Stories for Your Well-Being, I'm Alyssa Ivinson.